When should I see a doctor for isolated diastolic hypertension? Have you ever wondered when it's time to consult a doctor about isolated diastolic hypertension? This condition can be a bit tricky, so let's break it down. Isolated diastolic hypertension occurs when the diastolic blood pressure, which is the bottom number in a blood pressure reading, is elevated while the systolic blood pressure, the top number, remains normal. Typically, this means a diastolic reading above 80 or 90 millimeters of mercury with a normal systolic pressure. So, when should you see a doctor? First, if your diastolic blood pressure is consistently above 80 to 90 millimeters of mercury, it is a good idea to seek medical advice. This persistent elevation can indicate potential cardiovascular risks that need evaluation. Next, consider your overall health. If you have other cardiovascular risk factors, such as a high body mass index, elevated glucose levels, or high triglycerides, it is wise to consult a healthcare professional. Lifestyle factors like increased alcohol consumption can also play a role. Isolated diastolic hypertension often appears alongside these factors, increasing the risk of cardiovascular disease. Age is another important factor. If you are older or have existing cardiovascular conditions, it is advisable to see a doctor. While younger individuals may not require immediate treatment, older adults or those with pre-existing conditions may benefit from tailored treatment plans. Pay attention to any symptoms you might experience. If you have headaches, dizziness, chest pain, or shortness of breath, do not hesitate to seek medical evaluation. These symptoms can be related to high blood pressure or other cardiovascular issues and should be addressed promptly. Finally, if you are unsure about your blood pressure readings or have been diagnosed with isolated diastolic hypertension but are not currently under medical supervision, it is important to reach out to a healthcare provider. Awareness of isolated diastolic hypertension is often lower than other types of hypertension, so professional assessment can help clarify your condition and guide you on the best management options. In clinical practice, isolated diastolic hypertension is not always treated uniformly due to its varying association with cardiovascular events. Consulting a healthcare provider allows for a thorough assessment of your overall cardiovascular risk profile. This assessment can help determine if lifestyle changes or medication are necessary for your health. So remember, if your diastolic pressure is persistently high, especially with other risk factors or symptoms, seeing a doctor is a wise choice. Early evaluation can help prevent potential cardiovascular complications and ensure you receive personalized care tailored to your health needs.